Hello, everyone. In ELD and elderly care work, it is often necessary to assess the elderly person's physical condition through various methods. To understand the physical condition of the elderly, vital signs refer to temperature, pulse, respiration, and blood pressure. The measurement of vital signs is not only an indicator of the quality of life activities, but also an indicator of the severity of the condition. Caregivers, by carefully monitoring changes in the elderly person's vital signs, can provide important basis for disease development, diagnosis, and treatment. In this lesson, we'll learn how to measure the vital signs. First, conduct an assessment. Ensure the environment is clean. Temperature and humidity are appropriate. Evaluate the elderly. Assess the elderly person's consciousness level. Determine if the elderly person can cooperate with the procedure. Determine the care needs of the elderly. After assessment, find out that the elderly person is not feeling well, such as fever, respiratory problems, dizziness, etc., or requires hospitalization. Measure the elderly person's vital signs. To understand the physical condition of the elderly. To collect information. For follow-up medical care. 3. Planning. Measure the temperature, pulse, respiration, and blood pressure of the elderly. 4. Implementation. First, we take the temperature. Required supplies include a clean and sterilized thermometer. The thermometer should be calibrated below 35 degrees Celsius. Container for contaminated thermometers, timer. Tissue or gauze temperature recording sheet. For rectal temperature measurement. Additional lubricant, cotton swabs, and toilet paper are needed. The caregiver should dress neatly. Wash your hands. Bring supplies to the elderly person's bedside. Communicate first. Explain the purpose of the procedure to the elderly person. Check the bed number and name. One. Oral temperature measurement method. Measurement site. Place the mercury end of the thermometer diagonally under the tongue at the thermal fossa. Instruct the elderly person to close their mouth. Do not bite the thermometer. Breathe through the nose. Measurement time is 3 minutes. Two. Axillary temperature measurement. Measurement site. The mercury end of the thermometer is placed in the center of the armpit. Measurement method. First, dry axillary sweat with gauze or tissue. Then place the thermometer in close contact with axillary skin. Instruct the elderly person to flex arm across chest and clamp thermometer firmly. Measurement time, 10 minutes. 3. Rectal temperature measurement. Measurement position, e.g., lateral position, prone position, or supine position with knees flexed. Expose the measuring site. Measurement method. Firstly, lubricate the mercury end of the anal thermometer with lubricant. Then insert 3 to 4 centimeters into the elderly person's anus. Measurement time 3 minutes. Read the value of the thermometer after measurement. The caregiver assists the elderly person to remove the thermometer. If measuring anal temperature, wipe the anus with toilet paper. After removal, wipe the thermometer with sterile gauze. Hold the non-mercury end of the thermometer with one hand. The end of the thermometer away from the mercury column. Keep your eyes at the same level as the thermometer's scale. Then slowly turn the thermometer. When you see a clear column of mercury from the front, you can read the corresponding scale value. Recording. Record measurement method, temperature reading, and measurement time. E.g. axillary temperature of 36.7 degrees Celsius. Indicate the time. Assist the elderly to arrange their clothes after measurement. Help the elderly to lie in a comfortable position. Make up the bed unit. Precautions for temperature measurement. 1. Avoid factors affecting temperature measurement, such as cold/hot drinks, eating, strenuous exercise, emotional excitement, or bathing. If any of these apply, you need to rest quietly for more than 30 minutes, and then measure the body temperature. Contraindications for oral temperature measurement. Individuals with mental impairment, coma, oral disorders, post-oral/nasal surgery, or mouth breathing. Contraindications for axillary temperature measurement. Trauma, surgery, or inflammation of the axilla. Excessive axillary sweating, shoulder joint injury. Individuals who are too thin to clamp the thermometer tightly. Precautions for rectal temperature measurement. Individuals with rectal/anal surgery, diarrhea, or myocardial infarction should not undergo rectal temperature measurement if the thermometer is accidentally bitten during oral measurement, e.g., the thermometer breaks. First, immediately remove glass fragments to prevent injury. Then open windows for ventilation. Administer egg white or milk orally to slow mercury absorption. If condition permits, consume high-fiber foods to accelerate mercury excretion.